Okay. Okay, it's recording. Assalamualaikum warahmatullahi ta'ala wabarakatuh and a very good morning to all my fellow friends and colleagues. Okay, I am Dr. Noras Nida. You can call me Dr. Nida. I am a mother of 3 beautiful daughters born in Kelantan and stays in Kelantan. And I am also an otorhinolaryngologist, and that is very scientific, and I can translate it to you. I am an ear, nose and throat doctor from University Science Malaysia. Okay. I have about 16 years experience being a doctor, and I think 2/3 of my life I have dedicated to being an ENT, learning about ENT, right, and then perfecting my skills as a surgeon also. And being 2/3 being an ENT doctor, after that I pursue further 1/3 of my entire career to be a lecturer, and now I'm in one of the lecturer in ORL department in University Science Malaysia. Okay, well, in this 1 hour talk, I will share my knowledge and humble experience in managing nosebleed. But before I begin, right, may I know what is the aim of you attending this webinar? Can you type in the chat? I give you 2 minutes. Okay. Nak tahu kenapa hidung berdarah? Correct. Yes. Alhamdulillah, you came to the right sessions. To learn more, thank you, Ainul. Yes. To learn more about nose bleeding and its management. Yes, of course. You will learn, insyaAllah, in this 1 hour talk to know the practical steps to be taken as soon as it happens. Yes, we will go on to the emergency. Thank you, Sadrina. Refresh and updates on nosebleed. Thank you very much. That's an excellent aim. Okay, now let's move on to our topic of today. I will start sharing my screen now. Okay. So the topic of my presentation today is help, my nose is bleeding. So looking at this picture, you can see that this boy anime is having a very massive bleeding, right? So as what you have written in the chat box, at the end of this webinar, you will be able to know what is inside your nose. My nose and your nose is basically the same. What causes nosebleed? How to handle nosebleed? And when I should go to the hospital. Today, I'm going to talk about nosebleed, right? So before I start, I have one question. Have you or any of your friends have experienced having nosebleed? If yes, please type Y in the chat box, or you can just answer, unmute your microphone. Has any one of you ever experienced this? Okay, I saw so many yes in the chat box. Now, what is nosebleed actually? Nosebleed is called epistaxis in medical terms, right? So, it is basically originated from ancient Greek words epistaxin, which means bleeding from the nose. And there are 2 types of nose bleeding. I have to move this. Okay, there are 2 types of nose bleeding. How to classify that? It's bleeding from the nose. Yes, I have already mentioned that. It can be seen anterior or it can be seen as posterior. What is anterior? What is posterior? Anterior is where anterior can be seen like as this in this picture. However, posterior is inside the throat, right? You cannot see that. But as being a medical doctor, it's our job to identify, and it's good if parents can also identify this, because usually in anterior bleeding, it is visible. What about posterior bleeds? It's at the back of your nose. You cannot see. But there is one easy technique to see that. You can just ask your child to open the mouth. You open the mouth, then shine the lights, and you can see if there is presence of visible blood at the back of your throat. Right. And then you can also divide either this is local or systemic. So in local, it is basically involve the nose area, and systemic is outside the nose area. It can be either due to the medical illness, or it can be outside, such as our environment. And then when we look, before I begin further, let's look inside the nose, right? You have never seen what's inside your nose except my medical students. So here, being an ENT doctor, I fall in love with the nose, right? The nose is one of the most prominent organ in our body, right? You can see when you look, right? You look at your mirror, the first thing you see besides your eyes is your nose. And can you imagine your nose suddenly got what? Crumpled. Right, your face is not you anymore. You slightly change, right? And you are not that cute and that handsome anymore. And as we all know, besides being part of the facial aesthetic, nose is also function for breathing. You can smell, you can breathe, and also it helps with voice communication. What happens when you have runny nose? When you have a bad stuffy nose, you have a sore throat, your nose will become hoarse, right? It becomes very deep. Sometimes it's not your own voice anymore. And nose also helps in humidification of the air towards the lungs. That's why humidification is important. And we used to hear proverbs, right? Like long time ago, dari mata turun ke hati. But for me, being a rhinologist and nose surgeon, I don't find that it's very practical for me. For me, it's from your nose to my heart. Because now I tend to look at the facial, at the person, seeing the nose first. Is it in the good alignment? Is it properly positioned? Did the patient, did that person has something, a problem in the nose? And have you ever wondered what is inside your nose? Right? So outside is okay, but nobody knows what is inside. Right? It's a very dark area. So here in this video, I will show you what is inside our nose. This is what we routinely do in our clinic. So you can see the nose, we have a straight passage up to the back. And this is the place where, for those who did a COVID test for the swab, this is the place where we do a swab test. And you can see that this is the middle part of the nose. If you look at the video, then it is very pink, very nice looking mucosa. Then we will look up. Yes, when we look up at the top of the nose, this is where your smells organs lies, right? So this is the smell, and the lower part is for your breathing. This is that's why your nose can have both functions. And when we look at the cross-sectional area of the nose, it is fully supplied by the blood vessels, right? You can see there is various blood vessels here, multiple blood vessels here. And imagine if you have trauma or you accidentally prick your nose, right? You prick your nose and you have a very sharp nails. Of course, you can injure the mucosa. You can injure the mucosa because it is rich with blood supply, right? It's logic and it's practical. So, you want to watch again the video? Okay, let me see in the chats. Okay, no. So we will move on to the next slides. Okay, now we will go to the local factor of allergic, of of the nosebleeds, right? It can be divided, as I mentioned before, it can be divided into local and systemic causes. So have a look at this picture, right? From my right side, you can see that there is a huge reddish mass inside the nose. This will definitely cause nose bleeding, right? The second right, you can see there is sharp spurs pointing towards the nose. This will also cause nosebleed. And when you look, this is because of the injury. There is hematoma, patient is having motor vehicle accident, he just suddenly knocked his nose, and this can occur. But it's not just you have to have a growth in the nose for you to have a nosebleed, but sometimes oxygenation using prolonged usage of the nasal prong, especially those in the ward, can also predispose to epistaxis and nosebleeds. And what about foreign body? Anybody recognize this? This green, yellow, shiny things that is inside your nose. You can see this also in your cats. Those who are cat lovers and who didn't frequently wash their cats, you can see this. This is thick, right? This is cat teeth. It is usually situated at the ear. Yeah, you can see that the black things in the ear, it can also go to your nose and it can just suck in the blood from the mucosa of your nose. Then what will happen when it suck in, you just eat up the mucosa and patient can come in with nosebleed. Right. I remember that because we are now in monsoon season, rainy time. Now, the flood season is coming and most kids like to play with water. What they don't know is that in the water, there is also leech. I came across one cases, I think few years ago, right? They are happily bathing in the flood water. Then suddenly they came in with massive epistaxis. The blood is just pouring to the shirts. Right, we don't know. And the boy denies it's just no trauma, nothing. I just bathe in the water. So when we look in the nose, when we scope the patient, we can see there is one blackish thing moving. It's still alive, you know. And the sad thing is that we have to catch it in the nose. And being a leech, when I saw that also, I cried the whole operation theater. Oh my God, it's the leech. Right, it's very big and how to catch it. So after struggling and with some instrumentation and gadgets and with my staff nurse and my medical officer, we managed to kill that. Right, you know what we use? We put cocaine inside the nose. Yes, we spray the leech with all the chemicals so that it just died. Then we can take it out, right? So after hearing all these local factors of nosebleed, then let's focus on the most common causes. The most common causes of nosebleed in childhood is the first picture, photo A. Can you describe what the boy is doing? You can type in the chat box. Yes, korek hidung. Gatal hidung, picking his nose. Yes, excellent. My sons always do this. Correct, yes. Almost all kids like unintentionally, right? They like to put in. It's not just their little finger. I think most of all their fingers, they like to put inside, right? And the tendency to put in something inside the nose is also one of their habits because they are curious. They see a shiny bits, yellow, green bits. Wow, it's very shiny, it's very round. Can I put it in my nose? What happened? Right, because they are very ambitious, right? They're very, and then they also want to get the attention. Okay, it can happen also. So what happen if the boy is frequently korek hidung, pick his nose, digging his nose. Have you ever wondered how many centimeters, how many cm can our fingers go inside the nose? Have you ever measured? Right. And which finger you are using? This one or this one? 20 cm. Wow, super. You go up to the anus. Right. Okay, 2 to 3 cm, 2 cm. Right, terlebih 0. Okay, sorry Nazrin. Okay, 2 cm. It's basically 1 or 2 cm only. Just bypass this. Because when what you feel is that usually you will pick your nose if you felt something is stuck. Right, when you felt that you have difficulty to breathe in, you will try to remove the object. Right, because 2 to 3 cm is the location of your internal valve of the nose. That's why you will feel something if there is blockage. And do you know that the true length of the nose? Okay, wait I will get my model.
Ada model.
Oh,
Kami pun kelas.
Cross sectional.
Tak bangun lagi dua ni.
Okay, cross sectional, right? From the front till the back is almost 6 to 8 cm only. Tak panjang pun. Right. So, you correct is at the front, 1 or 2 cm only. But the problem is that at 1 to 2 cm in the front is where the vessels is very rich of blood supplies. And that's when nose picking is one of the most common nosebleeds in children, especially if it's less than 10 years old. Right. So what can you do? You will have this problem. You will let the kids continue bleeds. You will scold the kid, the children, the child. Why you pick your nose? And can this 3 years old understand? He just stand, okay, I won't do it, mom. And the next day, they will continue do it again. Right. Okay. Oh, you want the leash picture? I will show you later. I didn't put that in the video because I thought I'm afraid half of my participants will run away. That's why I put it later for those who are interested. And then usually if bleeding caused by digital trauma, it's usually minimal, right? You can see it once it is occur. It's just staining the part of the tissue cloth, right? Part at the corner of the tissue, half of the tissue, and sometimes it stains the pillows. And have you noticed that once you after a few minutes or after 5 to 10 minutes, it will stop, right? Because if the boy have a good immune system, have a good coagulation system, of course the bleeding will stop. Unless he got some problem with his blood or he got underlying medical problems, right? And then if you look at the photo B, right, what the ladies is doing. Can you type in the type chat? Sneezing, yes, the ladies is sneezing. Right. Why the ladies is sneezing? Is sneezing and rubbing her nose. Yes, correct, Zubir. Right. Azura, okay, sorry, it's Azura. Zubir is your father. Rubbing the nose and blowing the nose so hard, sneezing is all part of a disease. Right. If it's not a disease, once you remember when you're exposed to something, right? You're exposed to something, you are sweeping your floor, suddenly you start sneezing. One sneezing is okay. Everybody sneeze. It's a normal reflex, right? You don't have to worry. But what about if 10 times you wake up in the morning, you start achoo, 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 right? And the whole toilet is like a vibrato because of your sneeze. Then this is when this is pathological. Pathological meaning that you have to go and check either you have a allergic rhinitis or not. Because in allergic rhinitis, once you are exposed to any allergens, any dust, or you are eating some things that you are not supposed to eat, then it will trigger the allergic reaction. What will happen? You will start to sneeze. Sneeze, 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 and then your nose will become so stuffy, turns red, and then you will have a runny nose, right? Your nose will start having runny nose, you have a stuffy nose, it become blocked. And then after that, your eyes, watery eyes, and you got itchy eyes, and you got itchy face, and almost everything is going to be itchy. Right? That's allergic rhinitis. So what will happen in allergic rhinitis? Because of this frequent sneezing, right? Frequent rubbing the nose, right? Because once you are in the process and you have been this attack, right? You don't care. You want to try to remove it as fast as you can because it's very itchy, right? It gets you feel uncomfortable. Then what you do is that you start rubbing your nose, right? Blowing, rubbing. Imagine you do it 10 times per day. What will happen to your nose? What will happen to your nasal mucosa? Of course, there we got red. There will be swollen. And as I shown you before, right? As I shown you before, the nasal mucosa is very rich with vessel, and it is very small, fragile, and very thin. If you have 10 times rubbing your nose, definitely you will have a bleeding, right? Don't worry, Nurul. I will answer this letter. Yeah, just stay tuned for this, for the webinar. So a little bit on this, yes, I give an example of eating nasi kerabu because Kelantan is famous with nasi kerabu. You know you are allergic to that bowl of buduk in nasi kerabu, but you don't dare because this is the first time I came to Kelantan, right, with nasi kerabu kambing, you eat. And then you will experience all this kind of attack, sneezing, then you feel like you want to dig your nose further. But you have to remember, once you get this, usually the bleeding is very minimal. It's not that you have fresh blood like pouring, no. But each time you have this, then it will stop spontaneously, right? Oh, no worry, it's just minimal. Since I want to try it, then it can just go. Of course, it's very minimal, but it will occur each time you expose to the budu again. Right, so what you are going to do? It's easy. Go see an ENT doctor and treat your allergic rhinitis. Right, treat your allergic rhinitis. Get the medication so that your allergy will be controlled. Then you can see, then you can eat nasi kerabu happily. Right. Hi Pat, how are you? Okay, I saw Pat is coming in now. Sorry guys, she's my friend. Okay, now, besides local causes, right, allergic rhinitis, finger trauma, all those things inside your nose, don't forget, there are also other causes of nosebleed. We have hypertension. Atherosclerosis is thickening of the blood. There is blood disorder such as leukemia. If those who have kidney problem, right, those who frequently went to dialysis, right, they will be prone also to have nosebleed. And don't forget about the drugs, the medication, warfarin, aspirin. And I think nowadays everybody is taking aspirins to protect them from heart attack. But this also has long-standing side effect also. It can cause nosebleed. And we are living now in the area of tuberculosis. So TB can occur and can come in whatever situation. They can come with shortness of breath, difficulty in breathing, they can come with fever, they can come with cough, they can also come with nosebleed, right? So my medical students, don't forget about this. And what about environment? If you are staying in the smoke-prone area, if we are living with a smoking guy, right? Try to chase him out if he want to smoke, right? Get a snapshot of the picture, right, in the cigarettes box and put that everywhere so that it is a remembrance. For those who didn't ever see a cigarette smoking box, you can have a look. They paste all the disease related to smoking in that box. So you can put that also, right? Take a photo of that and put that in the fridge or anywhere. And also, it can be associated with chemicals, pollution, altitude, right? When you are in high altitude. But one of the most common nowadays is air conditioner. Everybody is living in the air conditioned room. My daughters will cry if I off their aircon, right? So what will happen in air conditioner? If you are staying in air conditioner room, usually the air tends to be very dry, right? The dryness effect plus, especially at night. So the dryness effect at night usually we predispose to formation of the crusting, right? Formation of crusting in medical. In our terms, we call it taiido, right? It leads to predispose to formation of taiido. So when you tend to remove that, right, crust, it will also scrape the mucosa and you will bleed. This is when you notice that sometimes, right, when you wake up in the morning, you saw your son's or your daughter's pillow full with blood. What happened? Right, go and check the aircon first. What setting you are using, how long you are using it. And if they're prone to have this each night, try to cut off the aircon. Usually what I advise my patient usually that they have to just put on the aircon and then just take it about 2 a.m. right, time it so that it will just stop and then turn off the fans. This is one of the preventive measure if those who cannot stay in the aircon. Now I will focus more towards hypertension. Right, hypertension is one of the most common illness in our community. Right, it is high BP. Living now, everybody live in stress, and all of us are prone to have high blood pressure. So what happened in hypertension? In hypertension, there will be thickening of the vessels. So once your blood pressure getting high, it cannot withstand. Everybody knows that the effect of hypertension, you are scared of stroke. Yes, you're bleeding in the brain, we call it stroke. If you have a block in your heart, we call it what? Heart attack, right? So it's as simple as the analogy. But what happens if you have the pressure is very high and in the nose? Of course, the nose also will bleed, right? That's it, because hypertension is the most common causes of adult referral for nosebleed. In my hospital here in USM, we noticed that when I receive a referral, right, doctor, you have a case of nosebleed in casualty. The first thing I ask is how old is the patient, because I have to determine either this is adult or children, because the causes might be slightly different, right? So if it's the adult, so I will ask them, did they have hypertension? Oh, doctor, we haven't checked yet. Okay, go and check the BP first. Most of the time, the blood pressure will shoot to 200. That's why the nose bleeds. Once you control the blood pressure, usually the bleeding will stop. But at that point of time, because it's bleeding, and most of the time, the blood between the hypertensive patient and the child who correct hidung is totally different. What I mean by totally different is that in the child, you can just use handkerchief, you can just use tissue. But in this hypertensive patient, tissue won't work, right? Handkerchief won't work. Usually, you will have a cup of blood, a bowl of blood, right? The shirt is totally red because it's massive bleeding. And most of the time, the bleeding cannot be seen anteriorly. Sometimes it's just very minimal, but when you look at the back, it's just pouring, right? Like a pipe water. This is hypertension. That's why you take your medication, Sharif, right? It's not just to control the BP, to prevent stroke, to prevent heart attack, to prevent all those hypertension-related disease. It's also used to control so that you don't have nosebleed. Because once you have nosebleed, it's very scary, you know. Seeing a child, you know, they came in with an epistaxis, right? When they see the blood, what did they do? They cry. Everybody's scared of the blood. But what happens if you have a full shirt full with blood? You panic? Of course you will panic, right? So what to do? If you have this kind of problem, go and see a doctor and control your hypertension. Any questions so far? No question. Good. You can just on your mic if you want to ask, because I'm moving to the second part of the webinar today. Because I saw so many chat. How does bleeding and blood clots occur during cold weather, please? Okay, because of the altitude. Okay. I stop 1 second to look at the chat because there's too long already. Smoker immune to that photos. Okay. We will make a new one. Don't worry. It doesn't work. Haha, ganas sangat korek hidung. Okay, Pat. I think for your answer, I need to give you another diagram. It's going to last about 10 to 15 minutes. So I will contact you later and explain. Because
Okay, sure.
Okay, don't worry. You will have I will contact you. Don't worry. It's a promise. So Sharif,
Okay, all right, thanks.
alamak lupa makan ubat. Okay, go and take your medication now. Okay. Now we will move on to the next part. Okay, can you have a look at this photo? What did you see? Can you comment on the chat box? Look at his face. Not just the blood. Look at his eyes. Look at his facial expression. What did you see? Go beyond the blood. Right. Go beyond the blood. Go beyond that. Look.
He was punched.
Was punched. Okay. Besides that, thank you for the answer. It can be one of the possibility. Look at his eyes. Darah berketul. Okay, good. Siti Fatimah. Allergy, superb. Blood at the nose and he feels sad. Yes. Yes, Lily. His eyes looks down, right? If you notice, he didn't focus. And there is somebody holding his head and he looks tired. What can we postulate in this picture? He is pale. He's uncomfortable. Yes. He is depressed. It can be also a case of child abuse. We don't know that. But looking at this picture, right, nosebleed is not a happy event. Right, being a child and being an adult also, right, you are scared because we are not supposed to have bleeding, right, except for women. And then with this, and when they come to you, if you don't know what to do, how the child is going to feel? Because for me, the first aid measures is important, right? You need to calm the patient, you need to calm the child, reassurance that it is okay to bleed, right? And at the same time, try to get for help, right? Now, once you look at the child photos, okay, I would like to bring you back to 30 years ago, right? At that 30 years ago, I think I'm in somewhere in standard 4 or 5, right? Standard 4 or 5 in the primary schools. So imagine you are standing, right, with your friends in an assembly in the queue, right? Because every primary school, they like to queue, right? Every morning they like to queue, and then usually before you go back to the house, they also go to the assembly halls and they gather. Imagine at that day, the sun is very hot, the fan is not moving, and you are crowded with each other in the rooms. And suddenly, you saw this one boy started having nosebleed, right? He started having nosebleed. He hold his hands and show to you as a friend that, oh God, my nose is bleeding, right? My nose is bleeding. And your friend started to cry. And being a good friend, right? I will bring this your friends to the teacher. Teacher, I have my friends here, Ahmad, who's having nosebleed. Right. My question now is that if you are the teacher at that day, right, there's no other teacher in that hall, what will you do? You can type in the chat box. Okay, lo, try to stop the bleeding. Basahkan kepala, letak air dekat hidung. My teacher gave tissue a lot and asked the boy to hold. Surprisingly, my daughter and my son were super calm when their nose bleeds. Seek medical attention, sit the student down and roll tissue, put at his nose. Yes, basahkan kepala. Thank you. Dongak kepala. Superb, Nazrin. Right. Suruh minum air. Okay. Thank you for all the response. Right. Lie him down, raise his legs. Okay, Juwita, you are doing it backwards. Okay, but it's good. Tundukkan kepala. I got so many response. Don't worry, I will explain to you later. What is it? Tekan batang hidung. Yes, most of you has answered it correctly. Right, partially, except few of you. Don't worry, we will learn this later. Okay, what you should do is that when you have a child come in with complaint of nosebleed, the first thing you should do is, as an adult, don't panic. As a friend also, don't panic. Stay calm. Think, where am I now? Is there a tissue nearby? Right, am I standing in the hot sun? So bring the kids to shelter first. Try to avoid the sun. Right. Then give him the tissue. The next step is that, of course, you can ask the other teacher to call his parents, right? While waiting for his parents to come, because his parent is working, the teacher should know how to do the first aid measures to control epistaxis. If it's occurred at home, you should know how to control epistaxis before you bring your child to the hospital. Sometimes with this measure, the bleeding stops. If the bleeding stops, Alhamdulillah. But if it's recur again, few seconds later, few minutes later, you try again, it stops, then it bleeds. Right, after 3 occasions, then go to the hospital. Right, so as a first aid measure of having a case of epistaxis, what you need to do is that first, sit the patients. Sits the child first. Put in a chair. Right. Put in a chair. Then bend forward. Not backwards, Nazrin. Why not backwards? Because if you put in backwards, you will swallow the blood. Right. Once you swallow the blood, it will goes to your stomach and you feel very sick, very uneasy. And then you will create a vicious cycle whereby you will start vomiting the blood. Vomiting is not a good, easy, happy process. You will be very crampy on the stomach, right? You feel very weak. So the proper method is that sit, move forward, right? Move forward a little bit, right? Bend the head forwards, then pinch the nose, right? There is 2 parts of the nose that you should know is that there is the soft part at the front and the hard part at the back. So pinch the soft part of your nose. Right. Pinch both nostrils. Make sure there is no air coming out. and tell the child to breathe through the mouth. Open the mouth. Okay. Because I have an occasion where I ask the patient to close the nose, and in that panic situation, because the blood is so much, patient also forgot to open the mouth to breathe. And suddenly he just, oh my God, why I cannot breathe? Right, it's just turned pale, congested, because in this panic situation, you forgot to tell the patient to breathe. Right, so open the mouth, breathe in, breathe out with the mouth, bending forward. How long are you going to do this? 5 to 10 minutes, it's okay. Right, usually if it's because of a minor trauma to the nose, just a minor injury to the mucosa, it will stop. Don't worry. And there are a few methods to facilitate stopping the bleeding, whereby you can take the ice pack and you can put it here. Well, one finger, put in the nose, then you can take the ice pack and put it here to facilitate the blood to stop. Right, then you breathe in, breathe out. If you felt something in your throat, try to spit it out. Don't swallow. Right, and if you have, and if the children knows how to gargle, right, with the water, right, you can ask them, you can just remove this temporarily after, usually after 5 to 10 minutes, I will start asking the patient to gargle, because we want to remove the excess blood in the throat. Right, so put the ice water, and then throw it. Do it several times. Usually the ice gargle also, the ice, we also helps to promote stopping the nosebleed. Any question about this? What about if you have a child? If a child, right, if the child don't know, keep crying, struggling, so put him in on your lap and pinch. The child knows, head tilted forward and squeeze firmly. Do this for 5 to 10 minutes. If it didn't stop, go to the hospital. Right. Just remember, the importance of these point methods is that it is very easy to do. Don't sleep the patient, because I used to watch this when I was in the primary school. Right. And my daughters always keep telling me she has a friend and her teacher bring her friends to the sick bay and ask her friends to sleep. Okay, sleep, tidur, rehat, right? No, that's an incorrect position to stop nosebleed, right? You cannot sleep. Do not tilt the head and do not pinch this upper part of the nose. Pinch the lower part, right? And if, as I told you before, if you do this method more than 20 minutes, it didn't stop, then please go to the hospital, right? And if teach your daughters, teach your children how to do this, because sometimes they can help their friends. Because I always teach my daughters to do this, because she sometimes when she has runny nose, she also prone to have this kind of bleeding. So she knows, my eldest one, Nabiha. And when she was, I think, standard 5 or 6, she has a friend. She told her friend that, and her friend got epistaxis. And when she asked the friend to do this, right, the bleeding almost stopped. But when the teacher came in, why you ask your friend to sit? Go to that room and sleep. And what my daughters do? Teacher, my mom told me that if you have nosebleed, you cannot sleep. You have to sit. And you know what the teacher did? My daughter got scolded. Subhanallah. It's a sad story. She came back telling me this. So I have to go to the school and make a talk to all the teachers how to take care of nosebleed. And what happened when you are going to go to the hospital, right? The red flags in nosebleed is that when you have large amount of bleeding, when you have recurrent nosebleed, even though it's minimal, persistent, one-sided nosebleed in a boy, if more than 1 month, go to the hospital, please. Nosebleed associated with one-sided nose block, and you have a nose discharge, and you have nosebleed, and it's foul smelly, very bad, very busuk. You cannot go to that kids, to that guy, right? It's because of there must be something inside his nose. And when Your friends start complaining, oh, I got nosebleed on and off, and I think I got loosening tooth, I got numbness here, and I notice I have neck swelling, right? Advise them to go to the hospital. And those who are also having nosebleed with blood disorder. And not to forget, when you have persistent bleeding, frequent bleeding, your blood in the body is depleting, right? Right? You lost blood. But if you lost blood and our normal body function is that within 120 days, you will start have a new blood. But if the blood is sudden, very massive, then you will start having anemia, right? How to detect anemia? When you have an episode of the blood loss, then you will start having palpitation, fatigue, and you will have pale. Then it is also advisable to go to the hospital. This is for medical students, right? The history taking is important, right? Knows how to differentiate between, is it first episode or recurrent? What are the amount? Is it both side and one side or both side? And what are the associated symptoms in this? And then look at the patient age. What is there any underlying medical illness? Is there any history of trauma, accident? And is there any complication of the bleeding? Right? It's very straightforward. And I want you to remember this, right, as a medical student. Okay, I can do this. So in these slides, this is one of the most important slides of all the things that I told you, the causes, how to prevent nosebleed. Now, when the air is dry, so you can go to the counter and buy a saline spray. Right? Use it every 2 to 3 hours while awake. And if your child has a nosebleed also, because of the epistaxis, right? Saline spray is also good to wash away the secretion in the nose. It's harmless. You just use water and a soap so that it's easily remove your mucus in the nose. And if you are staying long standing in the aircon, get a humidifier, get a diffuser, which is very good to humidify your rooms, not just your room getting very wangy, right? You have the effects of the water also. So it helps you to sleep. And for those kids who always got bleeding when you're sleeping, this is a good practice. And for those who like to dig, right? Who like to correct the hido, I advise the moms, go and get a Vaseline cream, right? Get a Vaseline cream, the blue cap, right? You can just put it on the cotton bud and just apply it every day if they have an episode of bleeding, or if you saw that your child is digging very nicely, right? And sometimes you can also place a cotton ball coated in Vaseline in the nostril to prevent them from digging. But you have to remember, cotton ball is also foreign object. Sometimes the kid can just push in. Oh, what is that? It's very nice, right? So before I end this session, we are about the end of our webinar already. I want you to watch this video, like look what happened, and then we're going to have a debrief. We're going to talk about this for 1 to 2 minutes, then I will end my session. Okay, let's watch the video together.
Oh, yeah.
You know those ones where...
Hold on. Gotta get this, buddy. Hello, Martin. Wasn't expecting to hear from you today. Wasn't Steve supposed to be sorting that out on Friday? Not a problem.
Alice is one of thousands of St. John Ambulance volunteers. She's fully trained in first aid and knows what to do in any situation.
Say something, buddy.
She can be the difference between life and death. But what she can't do is be there every time.
Briefly. Help! Help!
Okay, what is your takeaway when seeing this video? You can write in the chat. What did you see? Or you can on your microphone. What is the lesson you learned from this video?
Dr. Asnida Juwita here.
Yes.
Like I said just now, when you talk about teachers yang suruh baring and then bila, you know, your daughter cakap dia marah and all that, to me, number one, all teachers should have mandatory class and training for this. And I feel that all parents with young children should know what to do. I mean, a lot of people think first aid punya classes are very overrated lah, whatever, oh tak payahlah this and that, whatever. Like macam that boy, again, as the VO said, she may not be at the right place at the right time, although she is trained to help people. You know, she may be even, you know, way across the, you know, the street. Ya, dia tak nampak, sebenarnya dia lari untuk angkat baju dia. So
Yes.
that man didn't know what to do. Again, what I'm saying is everybody with small children really should learn first aid and about nose bleeding, the normal things yang budak-budak dapat, you know, because it does save lives. And also like CPR, I was at a wedding once and this man just fell off his chair because he was choking on a piece of meat. And everybody kelang kabut tak tahu nak buat apa. There was this boy, I think he was probably 12 or something. He came and he did CPR sebab dia belajar kat sekolah last week kind of thing, you know. And he saved that man's life, you know. So, yeah, I mean, really, this is something we really seriously need to learn because we cannot expect there will be someone nearby who can help.
Yes, thank you, Juwita. That's the message I want to send to all of you who attend my webinar today. Right, spread this knowledge. Right, tell your friend, teach your kids, your grandchildren how to take care of themselves. If it's not for you, right, I don't have kids, right, why should I learn? If it's not for you, it's for your friends, and it can be for somebody that you saw just across the roads. Right, you know about this, then you can just go and save him. Right, doing this is not just for the sake of you, it's for the sake of others also. Right, and you will be blessed if you help others. Is there any more questions? Because I saw there is.
Dr. Asnida, I have a question, but it's not related to the video. Can I ask this question?
Okay.
But my question actually, I wrote it on the chat box. What is the cause of a spontaneous bleeding that is quite frequent, about 3 times a week or twice a week?
Okay, may I know, because if with this kind of statement, I have to know, what are the age of the?
This is a person at the age of about in his mid 20s.
Mid 20s. So
Yes.
is it the bleeding is a lot? Is it massive or is just minimal that stop?
When it bleeds, it can be very massive.
Okay, it's a boy, right?
Yes, correct.
Yes, if it's very massive and it's very frequent, almost every day, there are few causes. First of all, when you came in, we will rule out. When you came into the general doctors, it's not ENT, right? You go to the hospital, to the clinic. What they will do is that they will take your blood and they will screen for medical causes. Do you have any blood disorders? Do you have hypertension? What about your kidney? What about your blood? That's what they do, right? If they cannot find anything in that line of management, then they will refer that to us, right? They make a referral to us, and it's for us to find what are the causes of bleeding. We will look at the nose, because usually if it's frequent, there must be something. If it's not something, then we have to look through what about the mucosa of the nose itself, right? Because there are various hereditary idiopathic things which is very in the gray area, whereby even though we cannot see the mass, right, the mucosa itself is disease.
Okay.
So you need to go and see a doctor.
It's not daily, but it's just once about probably 3 times a month, but it's not daily.
If you are in Kota Baru, I would like to see your friends.
Okay, thank you so much.
Get a nose check.
Yeah.
Okay.
Thanks for us. Yeah.
Okay, thank you, thank you. So I have 2 minutes. Nasri, can I have 2 minutes to have this? We will stop another 2 minutes to look at the chat. Okay, tekan basah hidung. Okay, doktor, kalau darah yang banyak dia keluar dekat mulut pula. Yes, of course if it goes because nose and mouth is related. So just spit the blood, meaning that if it's going out to the mouth, it's possibility of the posterior bleeding. Posterior bleeding cannot be stopped by the method that I told you. Right, you have to go to the hospital. There are tons of methods that we can do in the hospitals. If not having a chair, can he sit on the floor? Yes, he can sit. Just sitting. So if he sit, just raise his legs and put his head in between the legs and just in the stooping, in the forward position. You can sit on the floor also, it's okay. Okay, I think I have to end my webinar now. Thank you for listening.
Thank you. It's a fantastic session.
So if you have any problem, okay, you can email me. I put my email here, nida007@gmail.com. You can email me, inshallah. I can advise with my limited experience here. So we will see you again, inshallah. I will do this more in the future. We will focus one by one on the ENT topics, day by day living problem. Okay.
Thank
Thank
you
you
so
very
much.
much. Bye-bye.
Thank you.
Have a good lunch. Okay, bye-bye. Should we take a photo?
Thank you, doctor.
I want to take a photo. This is very memorable. Okay. Okay, Sharif, comb your hair. You're very messy.